Bring in Dr. Ashish Jha, Dean of the Brown University School of Public Health. Welcome back, Dr. Jha. So that's encouraging news from the CDC on schools and children. And we know the child infection rate is low, but it has increased a bit over the last couple of weeks, about 16%. What is that about?
Yeah, good morning, George. Thanks for having me on. What's happening basically is, as we've seen large outbreaks in the country, the last month or so, we've seen some very, very large numbers of infections. Kids have been getting more infected too. I don't think it's anything different. I don't think it's the new variant, for instance, playing a role. I think it is the part of a broader pattern of more people getting infected.
Overall, we are seeing some good news. Hospitalizations down over the week, cases down over the week, and now we do seem to be in something of a race between these vaccines and the variants.
Absolutely. This is the issue in front of us. These variants, particularly the UK variant, which is widespread across our country, is really starting to increase in cases. And it's going to wreak havoc on our hospitals unless we can get lots of people vaccinated very carefully and very quickly, So this is the race in front of us.
So the president is announcing a purchase of additional 200 million vaccine doses. Is that number high enough?
Yeah, I think the total number of doses we're going to have by the end of the summer is going to be plenty. I think by the time in the summer, we're actually going to have a situation where we're going to have more doses than we know what to do with. So I'm not worried about the summertime. I'm worried about the next couple of months. And anything we can do to increase supply in the next couple of months is going to be critical. I think by the time we get to the summer, we'll have plenty of vaccines for everybody.
In the meantime, mitigation is still so important. You're seeing some doctors now saying that everyone should be wearing these N95 masks to protect against mutations.
Yeah, in the ideal world, we would have had plenty of N95 masks. Again, we've known about N95s and their value for over a year. We've never really produced them in big enough numbers to have most Americans have access to it. There are alternatives, KF94s from South Korea, KN95s. They're not quite as good, but they're still an upgrade. Most people probably do need to upgrade their masks, especially right now with this variant.
How much of a difference is this Johnson & Johnson vaccine going to make? If it passes the trials, it's a single dose.
Yeah, I'm very excited about it. Again, I haven't seen the data, so got to look at the data. A single dose, relatively easy to store. I think it'll make an enormous difference. The problem is we're not going to have a lot of doses right away because, again, the production didn't really happen. So we're going to have to wait for that. But once it comes online, George, it's going to end up making a big difference.
Dr. Jha, thanks again for your time this morning.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.